Okay, so good morning, everyone. Thank you for joining today's Good to Go session. On this session, we'll be discussing what needs to be taken into consideration when organizing safe and COVID-secure trips. And I just thought that I should be sharing a presentation. I can't believe this. Apologies, everyone. There it is. I hope everyone can see that. If not, just give us a shout or leave a message on the chat. So there it is. Just a few things I'd like to say before we get going. So my name is Mariana Pacheco, and I'm the Support and Engagement Executive for England at CTA. This session will be co-hosted by me and my colleague Gemma. I'll be hosting and presenting, and then Gemma will be facilitating the chat and flagging any contributions that we believe might be worth sharing with everyone else. So Gemma, over to you.
Morning, everybody. Lovely to see you. As Mariana has said, for anybody that hasn't met me before, I'm the Support and Engagement Executive based in Swansea in South Wales. So Mariana and I are part of a team of Support and Engagement Executives that cover the whole of the UK, working with community transport operators, community groups, local authorities, health boards, just trying to provide the advice and guidance and any kind of specific tools and resources that you need to be able to keep delivering your services. So you should be able to see on the screen, we've got a couple of bits of housekeeping here just for you to be aware of. If you have got the option of having your video on, we do love to see your faces, but please don't feel that you have to have your video on. I feel like at the moment, Zoom fatigue is kicking in for a lot of people and you might just be sick of seeing your own face. So if that's the case for you, by all means, do switch your video off. But if you'd like us to see you, then that would be wonderful. We are recording this meeting just so that we can have it saved as a link on our website. So that is something to bear in mind, just in terms of having a video on and off as well. And we're going to be using the chat for questions and conversation, and we would welcome any kind of comments, feedback, questions, chat that you want to have in there. The plan is that Mariana is going to kick us off with a presentation first, and then we're going to go into a more discussion-based session in the second half. So in the meantime, I'll be monitoring the chat box. So if there's anything that you want to flag or a question that you want to raise, just pop it in there and I'll be making sure that I bring those up and we can bring you into the conversation. There are a couple of other colleagues from CTA with us today as well, so they'll be in the chat as well. So if one of us isn't able to answer your question, I'm sure we'll be able to find someone who can.
Okay, thank you, Gemma. So I guess we're ready to make a start. Okay, so here we go. So for community transport providers, restarting services means thinking about running trips to the shops, days out, and any other journeys into the community that so many people rely on. But in order to provide those services, one of the most important things you need to consider is the guidance issued to your nation. As you're all aware, guidance from UK government, Scottish government, Northern Ireland Executive and Welsh government is no longer consistent. So we've got lockdowns, we've got different tiers of restrictions in place across the UK. And because of that, operators should always confirm whether a journey is allowed to be carried out in their local area. It might that in some cases, it might be that the place where a passenger is picked up is under different restrictions from the place at which the passenger will be set down. So once again, you should always make sure that the whole journey is allowed to be carried out. And we're going to start with England. As everyone knows, we're currently under lockdown, which is expected to last until the 2nd of December. Essential journeys are still permitted. However, you can and should still travel for a number of reasons, including the ones that you can see on this slide. You can also access that section of the guidance in the link below in case you want to have a read at it. You can also, of course, run many of the new services that you may have undertaken during the first lockdown, such as delivery of food and prescriptions. For car schemes specifically, guidance states that because it is so difficult to socially distance in a car journey, you should avoid sharing a car with someone from outside your household or bubble. However, if you really have to do so, government has issued a list of recommendations that can help reducing the risk of transmission when sharing a car, which you can also see on this slide, and that's also the link for that specific section of the guidance. And in Wales, the fire rate lockdown ended on the 9th of November, and according to the current guidance, there are no travel restrictions in place. However, people are advised to think carefully about the journeys they take and people they meet, especially to and from areas with a higher incidence rate. Then, in Scotland, a tiered coronavirus response system came into effect on the 2nd of November with 5 tiers denoting different levels of restrictions. Tiers 3 and 4 have obviously the strictest limits on transport, in particular for journeys entering different localities. And as part of their guidance, the Scottish Government has issued a list of exemptions for tiers 3 and 4, where individuals are able to make essential journeys. However, they stress that these are not to be used as loopholes. This is a very extensive list. I haven't included it all on this slide. However, I've left the link below in case you'd like to access the full list. But I also thought of highlighting a few of the exemptions that might be applicable to the type of services you provide, which are travel for work or to provide voluntary and charitable services, travel to school, travel for essential shopping, travel for healthcare, and travel to provide care and assistance to a vulnerable person. Still in Scotland, the most prohibitive restrictions relate to sharing cars, as this has been recognised as a factor in the spread of the virus in Scotland. So if you're in a tier 3 or tier 4 area, you must follow the transport guidance I mentioned in the previous slide. However, the guidance for car sharing also applies to people in all 5 tiers, and it states that you should avoid car sharing with people from outside your household or bubble as much as possible. If not, once again, if not, Scottish Government also issued a list of recommendations that help reducing the risk of transmission when sharing a car, which you can also see on this slide. So I'm not going to go through the whole list, it's a lot to read, but as Gemma said, we'll be sending out the recording and the slides, and you can have a read at it later. And that takes us to Northern Ireland. So in Northern Ireland, additional measures were introduced on the 16th of October, and the current regulation is that you should avoid all unnecessary travel. The regulations do specify, however, that individuals are able to travel for recreational purpose to outdoor open spaces such as parks, forest parks, and visitor attraction, and that town centres remain open for business. Our advice is that you talk to your passengers about what journeys are absolutely necessary to be carried out, and for them to consider other options such as food or prescription delivery. And just going back to car schemes, this is nationwide advice, not just related to a specific nation. And I mean, you've seen the recommendations about opening windows for ventilation or asking the driver and passengers to wear a face covering. And related to that, I'd like to share 2 very interesting inputs that we received from a Midas training. So obviously during winter, no one really has an appetite to crack a window open. So he installed these wind deflectors in his car. And he has noticed that the temperature inside the car has remained at a comfortable level for the passengers while ventilation kept happening. So that's an idea. With regards to face covering, he has also warned us that operators might want to reconsider asking people to wear face shields like the one on the picture, because in the event of a collision and if the airbag is deployed, the impact may cause serious damage to the passenger's face. So these are 2 really interesting ideas that we thought would be worth sharing. And I'd like to emphasize that at CTA, we don't know what action will follow the current measures, as much as we'd like to advise you on that. But I can assure you that whatever the changes will be, We are committed to support you all and to provide you with the latest updates as and when guidance changes. So if you're a member, you'll definitely get our emails with any updates. And there's also you can also check our guidance on our website, as you can see on that link, and just keep updated. So that takes us to the second topic of our presentation. So besides following guidance, there's another very important thing that you need to do before restarting your services, which are risk assessments. Risk assessments are not about completely removing the risk, which is impossible. Risk assessments are about how you can do everything you possibly can to minimize risk. And as the situation is changing frequently, it's important to consider creating a new risk assessment every time your local tier or restrictions change. A risk assessment is not a one-off thing you do before you restart and then you forget all about it, okay? Also, make sure that you involve your staff, your volunteers, your passengers. They're the ones who you're trying to keep safe. So make sure you understand what their concerns are, what they perceive as a risk, that you are aware of how they're feeling and that they're comfortable with the measures that you've implemented. A little further on, we'll be going back to this topic, as more than ever, it is so important to communicate effectively with everyone within and outside your organization, but we'll get back to that. And finally, use your risk assessment to inform your policies and procedures. So every decision you make about day-to-day things, such as the frequency you clean your vehicles, how drivers should interact with passengers, this should all come back to your risk assessment. So make sure it is a useful and a practical document and not just a tick box exercise. And if you're a CTA member, you can log into our members area and access a whole suite of resources that we've developed. You can download our how-to guide, risk assessment templates, which you'll be able to edit and use for your own risk assessment, and also many external resources that were kindly provided by other members and that we think are really worth sharing. If you're not a CTA member, you can still download our how-to guide for risk assessments, as well as a COVID-19 specific risk assessment template. So that takes us to the third topic, which is communicating with passengers. More than ever, communicating effectively with your passengers is key to build their confidence back up. It is important that you keep them updated on what you're doing as an organization to keep them safe, but also you need to be clear about what actions you need them to take to make sure you keep risk at minimum levels for everyone else. And the first advice we've got for you is when you take a booking, and also before the passenger enters the vehicle, you should always check if in the last 14 days, the passenger or someone in their household or support bubble has had any symptoms of coronavirus or a positive test. And also you should check if they've been told to self-isolate by NHS Test and Trace or the NHS COVID-19 app. So make sure you ask them when you're taking the booking and before they enter the vehicle. This is very important. And as I've said previously, it is important that you keep your passengers informed about changes in your services, new measures that you're implementing, and what you're doing as an organization to keep them safe. So communication is key. So I thought of sharing these two pamphlets. One of them was developed by Norwich Door to Door, and the other one was developed by the UK government. These are very good examples of how to communicate in a simple but effective way. I'd also like to share with you this newsletter. So this was developed by Ability North and CIC. And before they restarted their services back in July, they sent this out to all of their passengers. So the fact that this was sent out beforehand, this gave people time to prepare for the new way that services would be run. And I think that makes so much sense. And also something I'd like to highlight is that section called 10-step guidance. I think that is really important, and I think it just helps people understanding, what to expect, what rules they should be following, and how the services will be running from then on. So this is a very good example of how to communicate with passengers. And one more thing I'd like to share is this video from Handicabs Lothian. In this video, they present the newly implemented measures, safety measures that their drivers have adhered to. So I'll gonna play it. So I hope you can hear it. It's got subtitles, but I hope you can hear it.
This wee film is to demonstrate the procedures that HCL drivers are undertaking to ensure the safety and well-being of our passengers when travelling with Dial-A-Ride and Dial-A-Bus. Up to 4 passengers may travel from the same household. Physical distancing does not apply to members of the same household and any carer or escort. Drivers will follow government guidelines re-attending work and are provided with appropriate personal protective equipment and cleaning materials. At the start of each shift, drivers will wash and clean their hands with soap and water for 20 seconds. Open their vehicle, wipe down all door handles. Clean the driver's area and all parts of the rear of the vehicle that may have come into contact with drivers, passengers, or escorts with antibacterial wipes or spray. Clean the vehicle floor with diluted disinfectant. We have also made some changes to our booking procedures in keeping with government guidelines. At the time of booking, you will be asked, how are you feeling? Do you have any symptoms associated with COVID-19? Such as high temperature or continuous cough, if you have noticed any difference in taste or smell, and if you are self-isolating. If you answer yes to any of these questions, then travel will be refused. When arriving at your home, drivers will be wearing a face covering. They will ask you the same questions again to see if there has been any changes since booking. If you answer yes to any of these questions, travel will be refused. The driver will provide any assistance you require from your home to the vehicle and to enter the vehicle, either by the side door or passenger lift. The driver will assist you with your seatbelt if required. Wheelchair passengers are secured using wheelchair tie-downs and a seatbelt. After each passenger has been dropped off, the driver will clean their hands with hand sanitizer, wipe down all surfaces with antibacterial wipes or spray that any passengers or escort may have come into contact with, such as seatbelt clips, armrests and grab rails. Wipes and single-use gloves will be bagged and disposed of as per government guidelines. At the end of each day, the driver will clean their hands with hand sanitizer, disinfect all surfaces with antibacterial wipes or spray, both in the front and in the rear of the vehicle, and clean the vehicle floor with diluted disinfectant. In addition, all vehicles will be deep cleaned weekly by using a Fogger ULV disinfectant mist sprayer. We look forward to seeing you soon.
So that was Handicabs Lothian, and
to ensure the safety and well-being of our passenger.
And now we move on to the last topic of our presentation, which is Christmas. What to say about Christmas? So at this point, no one knows what's going to happen. You know, what restrictions will look like during the Christmas season. And as much as I would like to tell you what to do and, you know, and how to prepare, I can't, and no one can at this point. But I know that the majority of you are already preparing for Christmas. I mean, this is the end of November already. So I think it's not about the Christmas, at this point, it's not about the type of services that you can provide during Christmas. It's about whether or not you can provide those services. And unfortunately, we'll have to wait a bit more to know what's going to happen. But the most important advice that at this point CTA would give to you is always follow government guidance. Whatever that government guidance is at, you know, by Christmas, that is what you should be following at all times, and carry out a risk assessment. You know, we can't stress this enough. It's really important that you carry out a risk assessment. So this is what we can say to you, the advice that we can give you at this point. And speaking of Christmas, I would just like to share this story from Norwich Door to Door. So Norwich Door to Door, every Christmas, they have this Christmas concert with the Poor England Singers. And they do this in the church, and it's a big event in town. They have like 500 people inside the church. When you think of it, it's just mad. because I mean, imagine now having 500 people in the same room. But obviously this year they can't do it the same way they used to do it every year. But they've adapted this survey, and they'll still be providing it. So this year what they're going to do is there'll be Norwich door-to-door minibuses will be transporting the Porringland singers to the doorstep of several residential homes, several sheltered accommodations, and they'll be singing on their doorstep and somehow still provide that magic, that Christmas magic that everyone loves, and alleviate a bit of the stress that this year has been as being for everyone. So this was an example I'd like to share with you. And another one is from Community Action Ledbury. So I know that John is in this call, so he'll be able to tell you all about this. But as I said before, you know, they're already planning ahead. The plans are underway, so it's just about whether or not they'll be able to run those plans. And some of the things they'll be doing during Christmas is the prescription and shopping runs. They're also planning their December community lunch and their Christmas meal trip. They'll also be having some of them mystery tours running. And as the name says, it's a mystery tour, so passengers book this trip, but they don't know where they're going. So it's a mystery. But they take their passengers around town or around a specific route, so that, you know, they can just get out of the house and see other people and just see town, you know, see something different than just four walls. They'll be also carrying out the Christmas shopping taking the passengers to the shops to do the Christmas shopping. And also, last but not important, their staff will be calling members and passengers to make sure that, you know, at this time of the year that they're not lonely, make sure that they're okay, and to make sure, you know, that any support they need, they'll be there for them. And any trips that they'll be carrying out, they'll be having 4 people on the minibus at a time, max, and always sanitizing it in between trips, which is really, really important. And yeah, this takes us to the last slide of our presentation. So I'll just like to spark the conversation with this question: what are your organization's plans for the Christmas season? So please, you know, let us know what you plan, what you're planning, or if you're not planning, because, you know, there's so much uncertainty at this point. Obviously, if there's anything else you'd like to say about about the other topics that we're presenting, please feel free to do so. But yeah, I just wanted to ask you, what are your plans for Christmas? And that's all from me at the moment. I'd like to thank you for your attention. Thank you for your time. As we've said previously, we'll be sending you the slides and the recording, so you'll be able to have a look at that later. I'd also like to invite you to visit our members area. So lately, we've been updating our resources, and there's quite a few of them in there that you know, you can have a look to and use for your own operation. So I'd just like to invite you to have a look at it. Then if you could please fill in our 1-minute evaluation, that'll be really good. I'd really appreciate that. And just like to say that we have another 4 events coming up this month and December, so you can see that below. So the next one will be on the 26th of November, will be Country Forum Wales Meet the Minister, but there's another 3 that you can attend as well. So if you'd like to book your place, just go to this website here, ctauk.org/online events. And finally, if any of you are not a CTA member, but if you'd like to know more about it, there's this website here you can also have a look to, or just get in touch with us and we would be glad to tell you a bit more about it. Yeah, and that's it from me now. So I'm gonna stop sharing now. And we're back to seeing everyone's faces. So
I'm just unmuting myself, sorry. We've had a really interesting conversation going on in the chat while you've been doing your slides, Mariana. Thanks so much. I'd like to, if I can, go back to sort of quite early on in the conversation. There was a bit of a chat going back and forth after the discussion about the face shields, plastic face shields, face coverings, face masks. And Thurston raised a question about whether it's mandatory for drivers to wear a face covering while they're transporting passengers. I don't know whether anyone's got, I know we had a bit of a conversation going back and forth in the chat. If there's anyone that wants to weigh in on that hasn't already in the chat, if you can unmute yourselves and give us a wave or stick your hand up using the icons at the bottom of the screen. Jenny?
We had, we're kind of mirroring what the local authority are doing as much as we can. So they said, this was last week, they were saying that they have to wear face masks when they're driving. They're now saying that if they wear glasses, they can take them off when they're driving, but when they're putting passengers on. But I found it tricky. There doesn't seem to be any, direct, this is a definite, yes, you do it this way, or you do it that way kind of thing. But I don't know whether your local authority might be able to help. It depends how helpful they are, really, doesn't it?
Yeah, absolutely. And I think it does make it difficult. I know that's one of the things that I popped in the chat at the time. There's different guidance in place in different settings. So, for example, in Scotland, I know for people who are conducting driving lessons, it's mandatory for the instructor and the driver, the learner, to have a face covering. But then when you look at the taxi and private hire guidance, that guidance is not the same. And very often there isn't a specific rule that's put out for those of us who are delivering community car schemes. So it's really challenging then, but I think it's trying to, as a couple of members have said in the conversation, making sure that you're doing as much as you can to maintain safety. It isn't possible to eliminate the risk altogether, but there is the potential for an additional hazard, as Mariana said, with those transparent plastic face shields, particularly for a driver when you've got the steering wheel. Something that Mike from Powys Association for Voluntary Action told us has been told is a risk where the driver potentially might have an injury as a result of the airbag deploying if they were involved in a road traffic collision. So I think Debbie from Pacto put something in the chat about it being advisable if you do need to wear a transparent face shield in addition to wearing a face covering, that would be advisable more in the times when you're in close contact with a passenger. So maybe when you are assisting them with putting in the wheelchair restraints in the minibus or helping them on and off the vehicle, those are the times when you're obviously much closer than the recommended 1 metre or 2 metre guidance. Does anyone want to add anything in there? Just having a little look to see if there's any waves. Okay, fab. Another question that we had from Angela. I don't know, Angela, if you want to unmute yourself and pose this question to the group yourself, with regards to a passenger who's shielding but would like to book a journey. Or you're still on mute at the moment. Let me see if I can unmute you.
Yeah, they are.
Perfect, thank you.
So, we're just querying again because the rules are different. We've now got members that are saying they've just started to receive the letters to say that they should be shielding again, even though we've been doing it for 2 weeks. But I'm gathering it's not our responsibility to reinforce that, because one example we've got one lady goes out with us 3 days a week. Her family know about one of them and have told her she's not allowed to go out, and she's staying in on that day so that she can get their phone call, but still coming out on the other 2 days because she doesn't want to stay in. But it's not for us to say no, is it?
I'll just kind of chip in. No, because the government is no longer recommending that we have to shield, it's on them to obey the NHS instructions, same as your doctor telling you to take a specific medication. It's on you if you want to take it or not. They can't force you to. So yeah, shielding is no longer mandatory unless you've been contacted by Test and Trace, at which point it is. But if it's just a healthcare thing, then no, it's entirely up to them. If we want to take them, then it's a bit of a 50-50 blame with the family. But you know, if they want to go out, I should have no reason why we shouldn't take them.
Okay.
Yeah, Yeah, I think for me that the distinction that's really important is with regards to whether they've been contacted by the test and trace system and told that they have to isolate. If you know that that has happened and then agree to transport that passenger, then that is going to constitute a risk because that person could be an infection risk as a result of contact. However, yeah, as Thurston said, he's absolutely right. It isn't mandatory for someone to shield in the same way as it was during the first lockdown. And ultimately, you know, we're talking about adults that have capacity to make decisions about themselves. So, you know, that has to be respected, I think, and we have to try and work with them to make sure that we're transporting them in as safe a way as we can.
Okay, thank you.
Thanks, Angela. Really good question. We had another question from Victoria. After the video you shared, Mariana, about the safety measures and things, with the restricted capacity, is it, Victoria, do you want to pose a question yourself rather than me speaking for you?
Yeah, I was just wondering, if you've only got 4 people on a bus to take them out for a day out, lunch or whatever, how do you make that journey cost effective?
Really good question. I know a lot of people have had to face this recently. Mark, you're shaking your head. Do you want to come in on this?
Yeah, the answer is it's not cost effective. We're operating dial-a-ride services now with 1 passenger. We are eating into funds that we have in reserve. Luckily, we do get a bit of support from the local authority, and we have a triangle funding, and we charge for dial-a-ride. It might be that some CTs have to consider increasing the cost of dial-a-ride, but we're just biting the bullet and taking the hit. We think the service is necessary because people are suffering from isolation and mental health issues, so we're managing somehow. Luckily, the government furlough scheme saved us. Or else we'd be like many other organisations, I think, non-existent.
Yeah, I mean, that's our worry, is that if we use up our reserves, then we're not going to have a charity later on down the line when we're needed again.
Yeah, I think that's a really, really important point. Terry, I can see you wanted to come in.
Oh, yeah. We had that problem of how do you make ends meet. At the outset of lockdown, we were offered £2,000, and we invested that in paying we didn't even pay her. She did it as a volunteer. We set up a Meals on Wheels service, which we delivered to anybody who wanted and accepted donations. It wasn't a huge affair. It was usually between 20 and 30 meals a time. But the money that we've had coming in now exceeds the original £2,000 that we started with. And so we've done it by diversification. Right now, I'm halfway through an email responding to somebody from a health board who says, can we help them get COVID tests delivered to a hospital for analysis? And I'm thinking, wow, if every community transport scheme in the country had that opportunity, then that would be in our best interest. But I also wanted to say, what are the special implications about me going and meeting somebody off the Iona ferry carrying a special sealed box for delivery to a hospital? Obviously, I'll wash my hands before and after. But it seems to me to be an easy approach to bringing in money that doesn't involve passengers, much as I'm concerned that they're stuck at home meanwhile.
Okay, really good question. Does anyone want to come back to Terry on that?
Yeah, if I can. We see the potential of carrying people who are hard to reach for vaccination in the not too distant future as a big option for us. And we're speaking to our local CCG and the powers that be, but perhaps it's something that the CTA need to be speaking to government about, because my voice here is not going to get heard around the country. There are going to be thousands and thousands of people who are not in a care home setting where they'll actually have someone visiting them to vaccinate, that are hard to reach and need to be taken to mass vaccination centres. Now, I think that's a role for community transport. I'm not saying we're going to earn vast amounts of money for it, but it might also be a way to fill some of the gaps that we've got financially, because there is health money available.
Yeah, I think that's a really good idea, Mark, and you know, fantastic that you're already involved in that conversation. And Terry as well, in terms of the opportunity to carry those vaccines and transport them, that again is a really exciting opportunity for CT to get involved. Specific regulations wise, you wouldn't have to worry about having a permit or anything in the vehicle, because you wouldn't be transporting passengers, you would be transporting goods. So it would just be about maintaining safety in terms of the actual carriage of whatever items they are. And as you say, it would be the standard hygiene practices for that. There may be additional requirements depending on who it is that the agreement is with. So I know we have some CT operators in South Wales that transport prescriptions, for example. So they are controlled medication, and there are requirements for some of them in terms of temperature control that you might have to comply with in order to make sure that the vaccine remains at a usable state. And in terms of the amount of time, because I know, like, say, for example, there's one of the vaccines where it's got to be used within 5 days. So you might have an agreement in place that you have to transport it within a certain time frame, for example. But I wouldn't have thought in terms of procedures, it would be wildly different from anything that you're doing at the moment in terms of transporting things in a safe and timely manner. Does anyone else want to come in on that before we move on?
Yeah, all I was going to say is, I mean, for us in terms of cost effectiveness on running a service, we have to run our, well, where it started is we have to run our minibuses at least once a week if they weren't being used for other things, just to keep everything ticking over correctly. So effectively, I was sending it around mainly country lanes because of where we are, to do a trip to just keep the battery charged, the gearboxes shifting gears smoothly, etc., etc. So to just put 4 people on and get them to pay was better than running around empty. And they're willing to get out and pay a reasonable amount. So we, at minimum, were covering the costs of wear and tear and petrol or diesel. But what we weren't doing was we weren't making the bit to cover the depreciation, etc., on the vehicle, but that was going to depreciate whether we ran it or we didn't. So I looked at it as at least a full cost recovery, and normally plus a little bit. Latterly, customers are saying, and I haven't taken advantage of it, we'd pay anything just to get out. So I haven't robbed them blind yet, but we do remind people that we are a charity. We're also VAT registered. So if I have to start charging for example, delivering outside of town someone's shopping, I'll have to put VAT on that. Whereas if they choose to make a donation, then we don't, because it's a donation. So we, generally speaking, ask people to make a donation, and they've been very, very good at doing that. So again, it's more than covered the costs of what we pay a volunteer in mileage to go out and do things. So I am working on some new trips that we can go. If a shop is open or a garden centre is opened, it's deemed essential, and thus if I'm taking people to them, then that must be an essential trip. So people are now very excited to go out, but I think Santa Claus has got to trim his beard because it was considered a potential home for COVID-19. So there'll be beardless Santas this year.
Thanks, John. I think, in all seriousness, I know I've spoken to an awful lot of members particularly in the last couple of months, where the financial burden of what we've gone through this year has become really worrying. And I know it's something that, where you're operating a service which is generally on a shoestring anyway, when that shoestring is stretched to breaking point, it does then create a real worry in terms of the long-term sustainability of what you're trying to deliver and the impact on the passengers who you serve in your local communities. So what I would say is, yeah, absolutely. You know, there's some comments in here about potentially drawing down some additional funding, checking your insurance to find out whether you might be eligible for a rebate. Thank you, Mark. I think that's a really good point that a lot of people are just not aware might be an option for them. Getting in contact with your local authority or your local health board, the local voluntary action organisation. I understand that particularly at the moment, there are some underspends which people are holding and they're looking to distribute to charitable organisations. So if you have a proposal, what I would say is try and go to these organisations and these individuals with a solution. Just say, look, I know that this is an issue. I know that there are passengers that need transporting. I know that there are people that need to get access to meals. I can solve this problem for you. I need this amount of money in order to make that happen. And if we can help you in putting those proposals together, if we can help, you know, if we can set up an event where we can, I don't know, workshop some of these proposals or get some ideas to you. I know my colleague Dylan is running a funding right shop at the beginning of December. Maybe we can have a look at some of these things with you there. But I would also really recommend having a chat with each other as well. I think that there's a real power in the community that we have within our membership. And there's a huge amount of knowledge and expertise. You know, we get together normally on a Friday morning just to have a chat with a network of members. And I know we have forums that run around the country as well. You have available to you a whole wealth of knowledge and expertise, and people are generally extremely willing to help and give advice, ideas, you know, suggestions about ways in which they've been able to secure funding, because it is a scary time. And I think it's really important that we're mindful of that and try and support you wherever we possibly can to get access to the information and the advice and the guidance that you need. Because we don't just want you to survive, we want you to thrive, we want you to progress beyond this initial sort of trauma that we've all experienced this year, because we know how absolutely essential you are to the communities that you're serving. So if there are things that we can do in helping you to answer those questions or make those connections, please just let us know. We will do our absolute level best to make that happen. I can see there's a couple of different bits in the chat, but obviously I've started running my mouth off now, so I haven't been monitoring it quite as much as I was previously. Anissa's just popped a comment in there about fundraising. Do you want to just talk to that, Anissa, in case anyone hasn't seen it in the chat?
I can do. I always love coming to spaces like this because it's like, oh, have we done this? Have we done this? And I was wondering about some of the stuff that we're planning to do to support members in the future. I think one of them is around direct fundraising, digital fundraising, given that we can't get into the end of a supermarket aisle and do a bag and shop. So a lot of the usual kind of income streams are sort of dried up. So what can we do as a membership organisation to support? And I was just a question about, do people, have we ever used things like sponsor a journey out or sponsor a trip out for someone as a marketing and as a way of making supporters giving into CT feel meaningful? It was just a question, so yeah, not an idea or anything, but Jenny says it's a good idea, so yeah. I was just curious about how you guys talk about the impact of giving into CT and whether doing it's a gift or an experience you're giving to someone.
Yeah, it's an interesting one. It's not something that I've seen done in CT. Is it something that anyone is doing at the moment or has got any experience with? No. Do any of you feel like that's something that potentially might be able to become part of your conversation? Yeah, I can see a couple of nods and thumbs up. Great. So maybe this is something that we can explore in a bit more detail, and Anissa, to see if there's some support that we can put in place for that. Fab. There's also some amazing things in here. Mark talking about the Coronavirus Community Support Fund giving £53,000 for a 30-minute bid. That's amazing. And Maggie sponsored Backwards Run Up a Hill, who raised £3,000. Sorry, Mark, go on.
Yeah, I'm just saying, anyone who's not tried to get some of the lottery government money needs to try. It's extremely easy. all you've got to be able to demonstrate is that COVID-19 has had a negative effect on your income generation, which we all can. Of that 53k, 20k was just for overhead support. They never asked any questions, and I could spend it on anything. It was literally an online process in 2 parts. It took 30 minutes. I did it on my own, no consultants, no accountants, a bit of proof of income, a Zoom call, and we had the money within, from start to finish, it took about 4 weeks.
Wow.
And that's saved us. Not only are we now sick, we've got breathing space. We're not pulling our hair out and terrified anymore. So you really need to have a crack at it if you can. It's a simple online process. You can go back to it as many times as you want. You just save and have a think about things, get your calculator out, go back to it. Really worth a try.
Amazing. We'll pull out the link for that and we'll circulate that to everybody in case that's something that people haven't yet come across, because I think that sounds like definitely one to explore if you haven't been able to as yet. As we're approaching the end of the meeting, I thought it would be nice if we can finish off by talking about some of the things that you are planning for Christmas. Mariana, is that okay with you? Yeah. So Maggie popped something in the chat earlier about delivering Christmas bags. Maggie, can you tell us a little bit about that?
Yeah, one of the community support groups got some funding from the recovery fund, and they're going to make up some bags as Christmas presents, Christmas present bags, and they've contacted us and the local Rotary group, the Scouts, and we're going to deliver them to all the houses before Christmas, because they normally have a Christmas party for older people, but this year obviously that's not going to happen, so they're making this up instead of, and it'll be a kind of intergenerational thing because some of the kids will be involved delivering that. So yeah.
Love that. I think that's a lovely, lovely thing. Wonderful. Angela, I saw you waving your hand as well.
Yeah, I just wanted to say I'm new in this position of helping. We've managed to get funds from the Monica Trust, which I know is nationwide. I put in a bid and they were very helpful. First one I didn't get right. Spoke to me and asked me how to do it. So they've now agreed to subsidise. Somebody was on about trips earlier. They now subsidise the seats that were missing on some of the trips, and they've also given us £360 towards taking some of our members out for their Christmas dinner.
Oh wow.
So that's another one to hit. And another funding pot I found, I'm only looking at little ones because I'm new, is Tesco giving £500. I hit that one, and because I said to them we fuel in their petrol station, we got given the funding for fuel.
Oh, amazing.
So yeah, they are there.
Yeah, brilliant. And was it the Monica Trust, the first one you mentioned, Angela?
Trust, yeah.
Brilliant. I'll make sure that link gets sent out.
They are nice little forms because I'm not experienced enough with big ones.
And sometimes there's such a massive task, aren't they? Like Mark describing that simple process is definitely not my experience of bidding for funding. So yeah.
I open it, and if it gets more than 5 pages, I'm like, nah, leave that. But yeah, those two were easy, and they were very helpful. They came back and said, this is what we need you to put. So,
excellent.
We've got, I think, 5 bubbles going out, hopefully, for Christmas dinners.
Lovely. Oh, that's wonderful. Thanks, Angela.
No worries.
Does anyone else want to tell us a little bit about what their plans are for Christmas trips and Christmas journeys this year? If you're able to put any on.
What I would say is, I don't want to sort of bring it down, but any of you that's got staff, it depends on what size you are. We're having a longer close down to save money. I know it sounds, a bit miserable, but we do some special needs school contracts. They finish on the 18th, and we are basically trying to shut down after that. We will have a skeleton staff, sort of transfer phone calls to my mobile and others, and we'll do any essential dialer rides. But other than that, it's one, use some of the holidays up that your staff have got loads of, need carrying over for next year. You know, switch your lecky and your gas off and save money. I've turned into Scrooge. I've got Father Christmas's beard, but I've turned into Scrooge. It's all about saving money. In other years, I would, as you can see, I'm a big fella, I would be dressed as Father Christmas driving a bus around town, but can't see it happening this year, folks.
No, I know. Unfortunately, there's a lot of the Santas that are going to be quite quiet this year, I think. But yeah, I think I know a lot of the volunteer schemes that I work with tend to take a bit of a break over Christmas anyway, because obviously the volunteers work their bums off right the way through the year and they want to take a break and spend some time with their families as well. So I know I've spoken to a few people recently that have said, oh, well, it's a good opportunity actually to have a little bit of a break because people are not traveling as much anyway and just stick to essential journeys only. But it's finding the right balance, isn't it, for you and your volunteers and your staff and the people that you're serving. Terry, did you want to come in?
Christmas dinner, isn't it? We've got our volunteer is quite happy to make a Christmas dinner to give to all the people that have supported us by buying their dinners, and they'll get it for free and they will give us donations despite the fact that we say they don't have to. And the same volunteer is doing Christmas dinner in our local village hall, and if it's allowed, and I'll get people there and away from it if it goes ahead. And if it doesn't go ahead, then I shall deliver Christmas dinners on Christmas Day. And if anybody wants to send me a red coat, then this is where Santa will be operating on the Isle of Mull.
Amazing.
Could we get you to wear a green coat? Because apparently Santa was traditionally associated with green, and it was Coca-Cola who changed it to red.
I'm more than happy to wear green rather than red.
Brilliant.
I'm sure you'll look smashing in either, Terry.
We're kind of going the opposite way in that we are closing officially, but we are taking it in turns to check emails and voicemails over the Christmas period, because people are already isolated. And for a lot of people think, thank God for that, I've got a week off work. For many people who aren't working, who are on their own, it's a long, long week. So we want to make sure that we're there and supporting them.
Excellent. Yeah, absolutely. Thanks, John. Does anyone else want to tell us a little bit about their plans or any other questions they might have?
Hello there.
Oh, I think that might have been an accidental unmuting. The joys of technology. Okay, I think we're coming to the end of our session, Mariana. Do you want to round things up?
Yeah, I can do that. I guess most important thing, just saying thank you for everyone for joining this session, for your time, for your attention to my presentation. I just want to say thank you to Gemma as well for facilitating the chat. I mean, she's a star at doing this, so thank you so much. And thanks everyone. And I don't know, is there anything else you'd like to ask or bring it up? We still have 5 minutes. Or share a fun story, Jenny.
Sorry, just to say, we did have a spot check from Health and Safety yesterday. Just be aware that I don't think it's just CTs, I think it's people going around to offices that are open. It is a COVID inspection. It was definitely HSE. Obviously, they don't announce themselves. We were fine and everything, but just to be aware that if your office is open, make sure that everyone is following the procedures all the time.
Yeah, we've had one as well. It was the Liverpool City region public health as well as the HSE. Fortunately, we got told that we're cleaner than the local ambulance service. So, and well, less people die on our buses as well, which is another good thing. But they are doing the rounds, to be honest. We operate a garage which is up to the public as well as our fleet, so they were keen on checking on that as well. But I think we will get targeted as well as everybody else, just to check, especially with hygiene. They were very impressed at the fogging and all the other stuff that we were doing. They've said there's a lot of commercial operators nowhere near us, so we were, I mean, I passed the information on to my board and they were massively happy.
Yeah, I think that's one of the real strengths for community transport, is because, I mean, you're obviously on it for the majority of the time anyway, with a lot of this stuff, much more than the commercial operators would be. But because of the nature of the passenger groups that you're transporting, I've seen some absolutely exemplary approaches to managing risk and looking after passengers' welfare. So, you know, I'm sure that for the majority, this isn't even something that would be a concern, but it's worth being mindful of the fact that these inspections are taking place, and just so that you know what to expect, and that they will be looking to make sure everything is to standard and above board. So thanks, Jenny, that's really useful to know.
Okay, so I guess we'll wrap things up now. Okay, so once again, thanks so much, everyone. And we'll be sending out the slides and recording once again. So if there was anything that you didn't have time to read, because I just moved to the next slide, you'll be able to read those. And if there's any questions, anything you'd like to know, just get in touch with us, you know, through advice, through our own emails. Feel free to do so. And yeah, I guess I'll see you in the next session or in the next advice drop-in. And have a good rest of your day. Have a lovely weekend, whatever the restrictions are, wherever you are in the country. So yeah, thanks so much.